It's superb for pain control. We've done randomized trials, as other people have, showing that you can significantly reduce pain. The strain in pain lies mainly in the brain, and you can learn to control it.
Hello, welcome everyone. It's great to be back with you live here on Sounds True One. It's been a few weeks since I've been with you live for Insights at the Edge, and it's great to be with my Sounds True One. I'm going to go ahead and say it. You guys feel like my Sounds True One family, so thank you for being with us here for this live edition of Insights at the Edge. In this episode, my guest is Dr. David Spiegel. He's one of the world's most respected experts in the clinical uses of hypnosis. He has personally taught more than 7,000 people how to use hypnosis to better manage their minds and bodies. And that's what we're going to be exploring, how we can use self-hypnosis in our own lives. Let me tell you a little bit more about Dr. Spiegel. He's a psychiatrist with more than 45 years of clinical and research experience, studying stress and health, pain control, sleep, psycho-oncology, and more. He is Associate Chair of Psychiatry and Behavioral Sciences at Stanford University, and he directs the Stanford Center on Stress and Health and the Stanford Center for Integrative Medicine. Dr. Spiegel is also the scientific director and the co-founder of an app that's called Reverie. Its mission is to make hypnosis mainstream and give hundreds of millions of people the tools they need to hypnotize themselves. Dr. Spiegel, welcome. As we get started, tell me a little bit how the area of the clinical use of hypnosis became an area of specialization for you. How did that evolve?
Well, Tami, it's something of a genetic illness in my family. Both of my parents were psychiatrists and psychoanalysts.
Oh my.
So they told me I was free to become any kind of psychiatrist I wanted to be. And here I am. My father was taught hypnosis when he was getting ready to go into combat in North Africa in World War II. And a Viennese refugee who couldn't himself serve, who was a forensic psychiatrist, had learned to use hypnosis for an odd reason. He had a smallpox scar right in the middle of his forehead. And he noticed when he was interviewing prisoners that some of them would suddenly sort of close their eyes and nod their heads and seem to go into some kind of altered state. And he started studying hypnosis and how people could shift into this highly focused but relaxed state of concentration. So he taught my father and a number of other young army docs how to use hypnosis to control pain, to help people with combat stress reactions. And so, as you can imagine, the dinner table conversations were pretty interesting as I'd hear about these cases. And I got to watch him making movies of patients who would suddenly have pseudo seizures. That's an epileptic-like attack without actually having a nerve damage in the brain. And so I went to medical school with the idea that I'd learn something about it. And I took a hypnosis course. And the thing that got me hooked was my first patient that I ever tried hypnosis with. I was a medical student at Children's Hospital in Boston, and the nurse said to me, "Spiegel, your next patient is in room 433. She's in status asthmaticus." Now, this means that she's got an asthma attack. She can't fully breathe. Her bronchioles are constricted. And I walk into the room. I followed the sound of the wheezing down the hall, walk into the room, and there's this pretty 15-year-old redheaded girl, knuckles white, struggling for breath. Her mother's standing there crying. Nurse is standing there. They tried giving epinephrine under the skin twice, didn't work. They were considering giving her general anesthesia and starting her on steroids. And I didn't know what to do. So I said, well, would you like to learn a breathing exercise? And she nodded. So I got her hypnotized. And then I realized that we hadn't gotten to asthma in the course yet. So I invented something very clever. I said, each breath you take will be a little deeper and a little easier. And within 5 minutes, she's lying back in bed. She's not wheezing anymore. Her mother stopped crying. The nurse ran out of the room, and my intern comes looking for me. And I figure he's going to pat me on the back and say, "What did you do, Spiegel?" And he said, "The nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent." Now, Massachusetts has a lot of weird laws. That's not on the list. And her mother was standing next to me in the room. But this is, there are a lot of sort of things crystallized in this experience. One of them is the misconceptions about hypnosis. It's either useless or dangerous or both. And people can't seem to believe that just an experience in your mind is something that can change what's going on in your body. We tend to think of people as broken machines, so ingestion, injection, or incision is what you have to do. That's a real treatment. And people controlling what's going on in their body with this wonderful organ up here that is connected to every part of the body somehow doesn't seem like a real intervention. So he said to me, "Well, you're going to have to stop doing this." And I said, "Oh, really? Why?" He said, "Because it might be dangerous. You might not be able to follow her." And I said, "Well, you're going to give her general anesthesia, put her on steroids, and you think my talking to her is dangerous? I don't think so. And I'm not going to tell my patients something I know isn't true. So take me off the case if you want, but otherwise I'm going to keep doing this." Now, she'd been hospitalized every month for 3 months in status. She had one subsequent hospitalization, but she went on to study to be a respiratory therapist. And what my intern did was he went to the attending, and they had a powwow over the weekend about what to do about this. And they came back with a radical idea at Children's Hospital. They said, "Let's ask the patient." I don't think they'd ever done that before. And she said, "Oh, I like this. I want to keep doing it." So she did, and I did. And I thought to myself, if you can help a patient that much, that fast, without any side effects, that's something that's got to be worth looking into. And I've been doing it ever since.
Now, you mentioned that there are a lot of misconceptions about hypnosis, and I think that's true. Can you educate us? What do you think is a realistic set of expectations we can have about the truth of the efficacy of hypnosis?
Well, hypnosis itself, Tami, is just a naturally occurring state of highly focused attention. Like when you get so caught up in a movie that you forget you're watching a movie, you enter the imagined world. The human brain has this remarkable ability to pick something to focus on and really focus intently and put everything else outside of awareness. So right now, Tami, if you're sitting on something, your body is sending you sensations, informing you that that's what you're doing, but hopefully you weren't even aware that that was happening. If it was, we can end the program early. So in the ability to attend, our brain says, pay attention to this and put other things outside of awareness. So you concentrate intently. It's like looking through a telephoto lens in a camera. What you see with great detail, but you're less aware of the context. You dissociate other things. And you do a third thing that is very important in making hypnosis such a powerful therapeutic tool. And that is you let go of your usual preconceptions of who you are and what you usually do. People used to think of that as suggestibility, but it isn't really suggestibility. It's cognitive flexibility. You say, I'm not going to worry about whether I've never done this before. I'm just going to do it. And so that's what my 15-year-old asthmatic did. She had never had the experience of aborting an asthma attack like that. So she didn't realize she couldn't do it. And so she did it. And that's one of the things that hypnosis can help people with is changing from the bottom up, not the top down. Make your body more comfortable, and then you can think more clearly. Change your perception of what it is you can possibly do and try being different. Try being someone who can actually take control over an asthma attack and relax your lungs instead of tensing them even more. Help yourself breathe better. So it's an opportunity that many of us have throughout our adult lives, but most children have when they're 8-year-old. Your 8-year-olds, you call them in for dinner, they don't hear you. They're busy playing or doing things that they're more interested in. And it's a mental ability that we underutilize. We all come with this big brain on the top of our bodies, but it doesn't come with a user's manual. And so we often don't take full advantage of it.
Have you found that there are certain conditions, like these are the conditions that hypnosis can really help with? And these are the ones, I don't know, I don't think I would, it's the wrong treatment for that particular condition.
Yes, it's very helpful for stress management, for just interrupting the cycle of physical and mental tension that makes stress get worse and worse and worse and leads to panic attacks and things like that. It's superb for pain control. We've done randomized trials, as other people have, showing that you can significantly reduce pain. The strain in pain lies mainly in the brain, and you can learn to control it. Pain is a combination of a physical signal coming to the brain and how the brain interprets it. So it's a tremendously powerful analgesic, and it doesn't kill 30,000 people a year the way opioids do in the United States. So it's safer and highly effective. It helps people go to sleep. That's one of our most popular uses, is that you can just interrupt that cycle of tension where you think, oh God, will I get to sleep? And the more tense, the more you fight it, the worse it gets. It can help people relax, let their bodies drift off to sleep. It's very helpful for habit control, like stopping smoking. And we find that 1 out of 5 people that learn to use it just stop smoking like that. And so it helps people eat more sensibly, to maintain a body weight that they want, eat a healthy diet, and enjoy eating more. Eat like a gourmet, even while you change what you eat and how much you eat. So problems like that, and also some more serious problems. We're teaching this in Reverie as a health and wellness skill that people can learn to use. All hypnosis is really self-hypnosis. But there are some people with more serious problems, like the aftermath of trauma, post-traumatic stress disorder, where hypnosis can also be very helpful.
Have people told you that your voice is very hypnotic?
I've heard that, and I'm glad. I'm glad to hear it. I didn't develop it that way, but I guess doing it enough has led me in that direction. So, or either that, or you've already been hypnotized, Tami.
Well, that brings me to my next point. One of the things I learned from your work, I familiarized myself a bit with a technical clinical book that you're the co-author of, Trance and Treatment.
Yes.
And in it, you go into quite some depth about how we're not all equally hypnotizable. Some of us are easily hypnotizable and others aren't. So tell me more about this idea and why it's such an important idea in the work that you do.
Well, Tami, hypnotizability is it's an oddly consistent trait. So as I mentioned earlier, most children are very hypnotizable. You know, you tell them a story, they take off, they're in it. You know, I used to put my kids to sleep by having them float down an imaginary river and say hi, good night to the animals and all this. And one time it didn't quite work. So my son, who was about 6, comes out looking for me and says, Dad, I need a professional. I really need someone else. But as we mature, as we go through adolescence and we learn to value logic more and experience less, some people lose that ability to engage themselves in intensely focused attention, hypnotizability. And by the time you're 21, your hypnotizability level is going to be about the same when you're 50. It's as stable as IQ. So I think it's an important concept because people used to be blamed as being resistant if they didn't go into a hypnotic state. God forbid this brilliant hypnotist couldn't get them into hypnosis, you know. Blaming the patient is never a good practice in medicine, and it's not a good practice there, and it's not true. The other thing is some people on the other end go into spontaneous hypnotic states and are a little puzzled or troubled by it. You know, I got so busy writing this paper that I missed dinner time, or I forgot 3 appointments I was supposed to have. Actors, if you tell good actors, you know, you were fantastic doing that, they look a little puzzled because they say, I was just being that person. You know, I wasn't trying to make it happen. So the nice thing is that it's an ability that some people have, but understanding that for me as a doctor using it, I don't blame the patient if they don't go into a hypnotic state, and I don't take inordinate credit if they do, because all hypnosis is really self-hypnosis. And my job is to guide them into it, help identify the state that they're in, and help them use it to deal with the problem that they have. That's my job. And so the old-fashioned thing with the dangling watches and counting upstairs and downstairs and taking 20 minutes or half an hour to get there is unnecessary. If you're very hypnotizable, you can get there in seconds. And if you're not, I can talk to you all day long and nothing's going to happen. So it helps us change our understanding of what it is and how we use it.